Hello and welcome to the Innovation Collaborative Conference today. I'm Laura Rooney from the AHSN Network and I'll be supporting with running the day. Today we'll be showcasing the fantastic efforts of local teams in implementing remote monitoring technologies to care for patients at home with examples from across England. We've also got a top lineup of local, regional and national speakers to take us through the day. Before we get started, can I encourage you to post questions using the question panel, and we can feed those through to speakers during their live sessions. And this event is all about collaboration, so please use the chat box to connect and engage with each other. This has been a big part of our previous events, so please do use the chat function. And if you're tweeting, please use hashtag NHSXInnovCollab. To officially open the show today, I will welcome Tara Donnelly, who's Chief Digital Officer at NHSX, who will be joined by Rod Joyce, Deputy Innovation Director, to talk about some new developments. So Tara, I'd like to welcome you to today's event and over to you.
Thank you very much, Laura, and a very warm welcome to everybody who's joined us today. It has been the strangest year, hasn't it? But amid the awfulness, there have been some great things to celebrate, and that's really going to be our theme of today, sharing some of the fantastic work that's happened across the country to advance digital home care and plan for how we can do more in the future. So just to give a little bit of an overview. So at the very beginning of the first wave, we worked with NHS partners to try a new model of care using an app and a pulse oximeter to monitor people with COVID at home. And that was the start of a journey that's led to the creation of 92 services across the whole NHS to look after people in this way. And then in September of last year, we partnered with the regions across England to really look at scaling up remote monitoring. And it was very open brief. It could be for people in care homes, for people with long-term conditions, physical or mental health, and indeed for acute COVID. We provided some funds for the implementation support because we continue to believe that the change management is the most important part to get right of any technology implementation. And very importantly, a support offer, this innovation collaborative, a microsite, events, resources for people to share. Eric Topol said last year, share more and get smarter faster. That is very much our mantra. There's no reason to reinvent the wheel when we're trying to work so quickly to benefit patients across the country. This important work very much continues in the current year. So today we're going to take that moment to reflect, to celebrate, and to think about how we can reach even more people moving forward. And just before I go any further, because we're a really mixed group today, it's fantastic that so many people are joining us, and some of you are very much involved in local projects. For others, this might be newer and just piqued your interest. So to say, what do we mean by digital home care? Because it is very much more than virtual consultations. It's about management of long-term conditions. 70% of time and energy in the NHS is spent on the management of long-term conditions, and sadly, quite a bit of that is in the complications of disease in hospital. But there is strong evidence that for many people, that ability to self-monitor and share your results with your clinical team can result in very significant outcomes in the short and the longer term. For care homes, there are these fantastic, what we call doc-in-a-box solutions, so technology that can give you vital signs information and help keep people well. And it's all about making an offer, not making assumptions about who might be interested, but actually offering it to anybody and finding that we might be pleasantly surprised. And of course, all services continue to be offered face-to-face if wished, but it's really about pathway change and empowering citizens with data about their own health. There have been 24 projects across the country. There are now 120 remote monitoring services, and we're reaching 1,200 care homes. And it's been fabulous to watch that number grow. We know how busy it has been out there. The vaccination push has been extraordinary. Acuity in hospitals has been really demanding. And yet the number has continued to grow since November. We believe this programme has reached nearly 80,000 people, thanks to your huge hard work. And we're delighted to support that. And a couple of stories from patients. Now, I won't read every bit of these slides, but I just want to give you a flavour. So Colin was really quite unwell with COVID, but very keen to stay at home. He was delighted to be offered a home package. He became quite unwell, had a visit to hospital, was diagnosed with pneumonia, but was still really keen to not be admitted to hospital if at all possible. So he was looked after, even though really quite unwell, at home under the supervision of the team. And his wife said, "I can't express how fantastic a service this is. It was like having them in the room with you at your side. I never felt I was on my own." And that example actually comes from Mersey Care, and you're going to be hearing from the Chief Exec of Mersey Care a little bit later on, Joe Rafferty. Derek is another example. Derek lives in Durham, and he's managed his warfarin at home rather than making regular trips into hospital. Again, he says now more than ever, the ability to use this fantastic automated system is a huge benefit to me and my family. And that project's being scaled up as a result of this funding. And then Barry James, who features in a podcast that I recommend you listen to with Zoe Harris, who set up the service. It's episode 2 of the Innovation Collaborative podcasts. And he says, "It reassures me, my wife and my family. I feel more able to manage my heart failure as I've learned what's normal for me, as I've recorded my data." And then a final example, reaching children in the Bradford area, using a little tool produced by Taito that is like a doctor's kit. And in fact, that's what his mum says, Shabnam. "I don't want to give mine away. It's like having a doctor's kit in my hand. So where I go, I know it's there." And these stories are really important to us to hear, both from clinicians. We've got a stack as well from people working in the NHS about what really matters and the difference that digital home care is making to them. We've seen 94 different types of benefit that have been outlined by a number of the plans. The most frequent is avoiding an emergency hospital admission to hospital, followed by reductions in GP appointments and A&E attendances. But we've also seen bed days saved, care being sped up dramatically, and improvements in patient experience measures. There's a number of examples here, just to give you a flavour. In the east of England, they've seen a reduction of 8.9% in A&E admissions from care homes with Wizan, compared to a 5.2 increase in those that are practicing without. In the northwest, the use of safe steps has resulted in 286 ambulance call outs obviated. The cardiology virtual ward in the northeast has saved 190 hours of clinical time. And finally, Reco Care project has saved over 670 emergency admissions, as well as they believe about 31 ITU admissions and almost 350 bed days saved, so almost a full bed for a year. We're going to go on to see a video now, and that's about how tech has been enabling physical health checks for people with mental health issues in Hertfordshire, using a Bluebox model. And I think Laura's going to put the video on now, please.
Last year, NHSX provided funding and support for a series of technology projects through its Innovation Collaborative programme. In Hertfordshire, people with mental health conditions are now benefiting from new remote monitoring technologies to improve their care. This is their story.
As a mental health organisation, we aspire to integrate physical and mental health, provide best care to our service users and carers in a holistic manner. And last 12 to 18 months, going through the COVID crisis, it became quite glaringly obvious for us that there was some work to be done. So Bluebox essentially is a blue box which consists of a number of user-friendly devices which can be used at home by the carer or service user in the comfort of their home setting to measure a number of physical health parameters, such as your blood pressure, temperature, oxygen saturation.
My role is as an expert by experience, and I'm also a service user. We have an involvement team in HPFT, and that's for service users and carers to hopefully make things better for other service users. I am terrified of technology. The Bluebox is so simple that if I don't struggle, nobody else is going to struggle.
You have individual medical tools that are all Bluetooth enabled, and inside the box is an Android tablet, and each device connects to that tablet to relay information. So what that means for us in the Trust is our clinicians have immediate, live, real-time data of all of the physical health metrics and scores that our service users have. So if we recognise any changes to the service user's physical well-being due to a medication change or similar, we can react to it much quicker and much easier than ever before.
It will save clinicians time because they won't need to make repeated appointments to go and see that service user to take those physical health measurements. We're constantly striving to look at ways that we can improve service user care, the safety of service users, and ultimately saving on clinicians' time and service users' time has got to be a primary outcome.
It's going to alleviate so much stress for service users. It's going to save people getting agitated and distressed, especially in these COVID times that having to go out. There's a reminder on the Bluebox that there's a voice that will actually tell you it's time to monitor.
So we've benefited hugely from the Innovation Collaborative in this project. So we've had peers from a number of different organisations, be that NHS organisations, but also third-party and care homes. We've been able to take the learnings from their experience, where things went well, where things didn't go well, and adapt that into our own project.
I feel really inspired, very excited. Clinical leadership is key to this initiative. My advice to other organisations who are ready to embrace technology, who are ready to really take this next step, would be to start with clinicians who are working on the ground, frontline staff. Excite them with this innovation. They will feel more empowered to take it up. They will be the ones who will be championing this technology for you, and that in itself drives clinical leadership ahead.
Be part of the journey. Join the Innovation Collaborative Workspace on Future NHS. #NHSX InnovCollab.
So a great example there. So what's next? So we were really delighted at the rapid scale, and by the end of March, 50,000 people benefiting. But our shared ambition is to reach at least 300,000 people in the year ahead. And this year, the focus is on three main areas. So improving the physical health of those with serious mental health issues, as we've just heard from that Hertfordshire example, increasing the scale of the care home work, so reaching more residents, and broadening work that has been focused on COVID. Happily, we can reduce that and now focus that resource on more long-term condition management. And we're also helping people develop the business case for a sustainable way forward, building a bit of a social movement for digital home care, and we hope you'll all be part of that, and linking into elective recovery as well. Just to say that this is part of a bigger programme called Supporting People at Home, and I won't go through every little bit of it, but just to say there are a series of digital playbooks about great examples from across the country on the NHSX website. Do have a look if that's of interest to you. And we've got work in hypertension with the home monitoring of blood pressure, dermatology, and eye care image sharing. And then finally, a really exciting piece of news about a partnership award launching today, which I will let Rod tell you a bit more about in a moment. But to find out more, do join our community if you're not already a member. There's the email address there, and it will also appear in the chat. But this really is where we're creating a unique space for adopting sites, documents you can download, cut and paste, experience of others, podcasts, videos, all sorts of resources in a microsite that will make it easier for people to bring about these changes at the pace that we all want. We also blog regularly. Do follow us on Twitter, and if that doesn't answer your questions, just drop us a line and we would be delighted to help. And a massive thank you. This has been such a huge collaborative effort and continues to be. And these are some of the many people that I wanted to thank for making such a step change happen in the way care is delivered. You've heard the quotes from patients saying what a difference it's making to their lives. And hopefully we can reach many more people together in the year ahead. I'll now pass to Rod, who's going to tell you a bit about this award that we're launching today. Thank you.
Thank you, Tara, and good morning, everybody. So as Tara said, we're really excited to launch the Digital Health Partnerships Award today, with the first iteration of the award having a real focus on supporting people at home. We know the NHS collaborates with partners from across the health and care ecosystem every day and supports our aims of improving patient outcomes, ensuring the NHS workforce has access to the right tools it needs and meets the requirements set out in the long-term plan. So the Partnership Award has been created to help accelerate the adoption and scaling of that most impactful digital health technology, and by maximising the opportunity these partnerships offer. We see the award as a real extension of the work the team have already delivered to date, that Tara's obviously been talking about, and that's helped build that digital capability across all 7 regions. And again, building on that work done, we can look at scaling more digital health technology across the country outside of some of those core areas that Tara mentioned. But what we found in a lot of the work we've done to date is how critical partnerships are to the delivery of that scale. So some of the headlines for the award. The awards will need to be submitted by an NHS organisation. Each bid will need to demonstrate how local, regional and/or national partnerships will deliver that rapid scale deployment and uptake of those solutions. Partners can include other NHS health and care organisations, higher education institutions, charities, not-for-profit, voluntary, all the way through to local authorities and commercial organisations. That is not an exhaustive list, but just an example list of the types of partnerships that we've been looking at. But really critically, I think each bid needs to demonstrate how they'll use a combination of partners across 3 key areas. So the first being leveraging technology partners, the second being patient activation and adoption, and the third being partners to help measure outcomes, benefits and evidence of impact. 3 really key areas that we've identified where partners can really support the NHS drive the adoption and scale of that digital health technology. So just onto my last slide, I won't be long. NHS organisations will be able to bid for the funding to support ready to scale projects across digital health tech. Organisations are asked to demonstrate how their bid can work across an individual or a combination of the following 4 areas. So the optimization of care pathways, patient-centred data exchange, self-management and prevention advice, and then system efficiencies to help support the NHS workforce. There's a huge amount of information that we'll be publishing today on the NHSX website, so I won't go into too much detail further on those. You can see it on the screen. But again, exactly the same as Tara mentioned for the regional scale plans, all these bids will need to demonstrate an impactful and sustainable plan. We do want to ensure that all digital health tech used in these bids meet or is working towards the DTAC criteria. And then funding is available in 3 categories, up to 100,000, up to 250,000, up to 500,000. Applications will be opening soon. All the information I said will be published on the NHSX website today. We'll be circulating the link to everybody during the conference today, so please do look out for it. There will be an email address on that, so please do register your interest, and we will make sure that you are kept up to date with the question set, the opening dates, the closing dates, etc., and the process. So that's all from me today. Thank you very much, and we do really look forward to receiving those applications soon. Thank you.
Great. Thank you for that. And thank you both for a great introduction and start to the day and giving us a taster of how these technologies have been benefiting patients and services. So thank you both. It's great to see lots of interaction in the chat as well. So please keep doing that. And also, if you do have any key questions or comments, just pop them through on the question panel and we'll direct them to speakers through the day. Okay, I will be handing over to my colleague Breed in a moment, who will take us through the next session.